Hello, good morning. My name is Bikkel, and today I'm going to present about the key features of healthcare market that it makes it different from other markets. Our overview of the presentation will be like this. First of all, I will talk about the ideal market, and then I will talk about why healthcare is different from ideal market. And finally, we will come to the role of government and the institutions that have emerged. First, let's start with the ideal market. So what happens in the ideal market is the law of supply and demand, which dominates it. The law of demand says when price goes up, the quantity demanded goes down, and vice versa. When the price goes down, the quantity demanded goes up. So similarly, when price increase, the quantity supply increases as well, and when price falls, the quantity supplied falls as well. So the ideal market is for profit. So the firms, their aim is to increase the profit and at the same time to increase the market share, which is highlighted by Adam Smith in his book, The Wealth of Nations. In an ideal market, there is no information asymmetry. That means the consumer has the best information. She knows what to buy, where to buy, when to buy, and what amount. And there is low regulations. So of course, there are some regulations, but if more regulations are there, it is thought that it will lead to market distortion or eventually even to market failure. So, of course, there are other features of an ideal market which we will we cannot cover in this presentation, but these are the basic features. So now we will go to the healthcare market, why it is different. So in healthcare, we have to differentiate between demand and needs. In an ideal market, if I want to purchase some goods or products, that is my demand, that is my wish. But healthcare cannot be regarded as a product, because it is a need. For example, if I have a toothache, I need to go to the doctor, to the dentist. So this is not my wish or demand, it is my need, because it would help me to live a healthy life. So the second point is uncertainty. You don't know when you will be sick, for how long, and how much it would cost you. Um, in an ideal market, you know what to buy, where to buy, and so on. In healthcare, you don't know. Um, so it makes it different. And there is a problem of information asymmetry, because health information is complex, and the healthcare providers, for example, doctors, have a long trainings, which will take years long to finish the studies and to get the license to practice as a doctor. So, as a patient or as a consumer, we rely on doctors to provide us the best information possible and to decide for us which care to take. This develops the relationship called principal-agent relationship. That means the doctors act on our behalf, choose for us, make the best choice for us. However, this has some drawbacks as well. For example, the supplier-induced demand. In the case of free market based system, where the doctors are motivated to make profit, they might end up prescribing more drugs than necessary, or offering more treatment than it would be necessary. So the evidence has shown that in the free market based systems, for example in the US or even in some developing countries, doctors have been prescribing more than in a country where there is no market-based healthcare. This has consequences on our finance. It has some side effects, and of course, it can build up some kind of resistance. For example, the issue with antibiotic resistance. So these are the basic differences of healthcare in comparison to ideal market. So now we come to the market forms, why the form of market in healthcare is different. First point is monopoly. Monopoly in an ideal market is not regarded as the best system because there is just one provider, and we as consumers have no choices. So if a firm is selling low quality good, we have no other choice than to buy it or not to buy it. So, and the firm has no incentive to produce better quality goods. In healthcare, however, the government is the has the monopoly as a healthcare provider. Um, Talking about oligopoly, which is the system where there are few firms, there are some sectors in the free market that oligopoly exists, but in healthcare, for some strategic reasons, um, pharmaceuticals, for example, um, it is a kind of industry where it is very hard for the newcomers to enter the market because to provide to bring a drug to the market, studies has shown that it takes in average 10 to 12 years, cost over 2 billion US dollars, and 90% of the drugs fail to come to the market. So it is huge cost. So for that reason, the governments have given license to few existing pharmaceuticals and give them the right to produce the drug, or how we call in economics a patent, for 20 years. And on the other hand, there is oligopoly in the form of health insurance market. It is again to bring some market forces in healthcare so that the consumers or patient have some choice to choose between the healthcare markets based on the best offers, best packages for them. And the third different in market form is healthcare is not for profit. So now the third criteria for healthcare is the role of government. In an ideal market, the role of government is minimal because more government intervention would lead to market failure. In healthcare, however, it is very important. For example, in the form of externalities. In an ideal market, if I choose to buy some good, it has low or no externalities on other people. In healthcare, however, if I vaccinate, but the large part of public are not vaccinated, I still have chances to get the communicable disease that makes me better off and gives me intention not to vaccinate as well. On the other hand, if more people vaccinate, the chances, the likelihood that the disease are transferred from one person to the other are less likely. So the government has a role to play in it, bringing it rules and regulations. For example, some vaccinations in many countries are mandatory, otherwise you don't get admissions in the school or something. Similarly, there are some negative externalities. For example, smoking. If I don't smoke but other people smoke near me, I will have negative consequences on my health as well. So the role of government is to mitigate the negative externalities and by bringing laws and rules and regulations and so on. The third point is equity. Free market don't care in most of the cases about equity, and a product in the free market, the price of a product would be the same either you are rich or poor. However, in healthcare, it might not be the best thing to do because the rich can pay more because they can afford it anyway, and the poor can pay less. And there are some group of people in the general population who cannot pay anything because of the poverty, or they are elderly or children and so on. In that case, the government can step in and to bear the cost for them. Um, so there is price discrimination, which is, in my opinion, is a good thing in healthcare because um, if we see country like Germany, where you have to pay 15% of your income for health insurance, and half of it is paid by you, and half of it will be covered by the employers. So person earning 1,000 euro in a month end up paying less than the person earning 10,000 in a month, which is a fair system, which where we can say that it might be fair to be unequal. Because of these kind of special features in health market, some institutions have emerged, for example, health insurance market. As we told before, there are uncertainty in health market. You don't know when you will be sick, how much it will cost you, and so on. And to avoid that risk, health insurance markets has emerged. They act on behalf of customers. They provide customers with the best solutions and what kind of package to purchase and so on. However, in health insurance market, there can be two problems of moral hazard and adverse selection. Moral hazard means because of being insured, I have incentive to participate in unhealthy activities like smoking or drinking soft drinks with lots of sugars and so on, because I know that if I become sick or something, my health insurance company will pay the price for me anyway, so I have no incentive to not to act like this. On the other hand, we have adverse selection. That means in a health insurance market, if I'm more certain that I will need health treatments in the future, I'm more likely to get an insurance. On the other hand, if I am healthy, I know that I don't need health insurance. Like the more healthy people are less likely to get health insurance. So, which makes the insurance companies worse off. So, for that reason, governments should emerge to help the insurance companies, and government itself has emerged as an institution. To note, however, that in the system of universal health care, for example, the NHS in the UK, there is no problem of adverse selection because everybody are covered anyway. So, having said that, the government have itself emerged as an institutions to in this regard. There are a few things that the government can do or should do. First of all, is the guarantee that everybody are getting fair share of health market, that there is equity, to finance healthcare, attempt to correct market failure and provide the best information for research and ensure that the healthcare has a good quality, it runs with cost efficiency and so on. So the third institutions that have emerged recently are the NGOs and charities, because there are some people in the society who might not be covered by the normal health system, for example, the undocumented migrants. In that cases, NGOs and charities are providing them with some treatment and consultations and so on. And we have seen recently there are some natural disasters where government are too late. Government are not so efficient in acting faster. In that case, the charities and NGOs has emerged as providing care for the people in need. Well, that was the part of the presentation. Thank you very much for listening.